Hello, assalamu alaikum. Welcome back to my channel. And as I promised, we left previous video on homeless topic. So we are on chapter 5, page number 72 and unit 2. So this is homeless. Okay, so we start reading word to word sounders book to prepare Nclex RN exam preparation, and we don't have time to waste, so we will start. Homeless affects any person from all backgrounds and family units can be affected as a whole. Look here, it's a pyramid point. We have to read this. There is a risk for early death related to health problems. Box 5.5 lists common health problems. Disability often results from illness and become a barrier to employment, which further augment the problem of homelessness. Infants affected by homelessness often have low birth weight and are more likely to die within the first 12 months of life than infants in other population groups. So, we are going to read about box 5.4 links between homeless and health and common problems in the homeless. This box I am going to post on my community post as well. If you wish to see the picture, I will post there. So, links between homeless and health. Let's read about it. Limited access to healthcare, problems getting enough food, difficulty staying safe, violence, stress, unsanitary living conditions, exposure to extreme in weather. Common health problems, dental problems, malnutrition, sexually transmitted diseases including HIV and AIDS, lung diseases including bronchitis, tuberculosis, and pneumonia, infectious and communicable diseases, mental health problems, substance abuse problems, wound and skin infection. So, we are going to read further. Children affected by homelessness are sick more often with illness such as asthma, iron deficiency, lead poisoning, ear infections, gastrointestinal illness, and behavioral and mental health problems. Children may begin to act out or become less attentive in the classroom when basic needs are not met. Youth experience health problems related to risk-taking behavior such as alcohol and drug abuse, and depression and suicide are concerns. Unintended pregnancy and sexually transmitted infections are a concern. Physical and sexual abuse is also a concern. Healthcare consideration for the homelessness. See, again they have mentioned about the box, clinical judgment prioritize hypothesis box. We are going to read about this box, and the picture of this box I am going to post on my community share. You will find most of the pictures on my community share, guys, related to Nclex. Clinical judgment prioritize hypothesis. A client who is homeless comes to the healthcare clinic for treatment of a painful open wound, foot wound. Priority client needs include the following. Let's guide. Read carefully, listen carefully. These are the really important issues and important points to digest yourself, because if you are going to take Nclex RN exam, then it is really important to read and write and listen and try to understand. Provide measure for pain relief. Identify the cause of the open wound. Assess and treat the open foot wound. Provide care with a non-judgmental and non-threatening approach. Determine medical history and existing health problems. Provide available access to healthcare resources. Establish an emergency contact person if available. Establish a follow-up plan of care. So, identification of those who are homeless needs to be accomplished through avenues such as outreach programs. The initial healthcare visits and every visit thereafter need to be done with a non-judgment, non-threatening approach. The nurse need to focus on reported symptoms. First, this will encourage adherence and follow-up. Subsequent care should include health maintenance, attention to common problems and concern, and establishing an emergency contact person if available. Members of the homeless population may not adhere to medical treatment recommendations and therefore require close follow up as much as possible. This population tends to have longer hospital stays and poor health outcomes. Certain medications need to be avoided in the homeless population due to the potential for, let's go next page, potential for abuse, and because of contraindications in chronic conditions, the nurse needs to ensure that any medication prescribed is safe for the person. Multiple resources are available to increase access to healthcare for the homeless population, and the nurse needs to establish connections for the client as appropriate. See, again, there is a website. If you want to go for this website, this is here, it is. For more information, let's go, guys. We are going to read about socio-economically disadvantaged individual and families. In Nclex, you have to read, you have to study everything, each and every point. It is important what is happening in USA because you are going to work as a RN, and as a RN you have to deal all these things. A disadvantage in the socio-economic sense can correlate with poor health outcomes. Educational level, income, family, social support, and community safety are social determinants that can influence health and health outcomes. Number C, the social determinants of health are equally as important in promoting positive health outcomes as engaging in the healthy lifestyle and having access to routine quality care. This pyramid point again is very important. Individuals of low socio-economic status are more likely to engage in risky health behaviors. Due to limited financial resources, these individuals are at a high risk for chronic disease and any disease associated with primary prevention. The health of children can be affected later in life due to risk factor. Healthcare consideration for socioeconomically disadvantaged individuals and families. Social worker services are help in connecting this population to need healthcare services and resources to assist in paying for healthcare. The nurse needs to carefully assess the client for at-risk behavior and intervene appropriately, including providing education. The nurse also needs to initiate social service contact to ensure adequate health care. So listen, guys, have you seen? You have to contact social worker, you have to contact, to educational programs and social services. These all are nurse as a RN, your responsibilities. Uninsured and underinsured individuals. We have to understand this as well as a RN. Individuals with low incomes are most at risk for being uninsured or underinsured. Those who are uninsured or underinsured are at increased risk for health complications due to lack of access to care and the likelihood that preventive care service and chronic disease management will not be sought. Most individuals receive health insurance coverage through an employer. If the employer does not offer this coverage, the employee is at risk for being uninsured or underinsured. Medicaid is an option for some low-income families who meet eligibility criteria. Commercial insurance is another option but may still be cost prohibitive depending on the individual circumstances. There, let's go, guys. Here, the client should be referred to social services or financial services to apply for Medicaid. In USA they do insurance, so the medical health care is very, very precious, and because it is insured by some other companies, it is not free, so we have to take care of insurers and uninsured persons as well. Risk factors refer to risk factors for socio-economically disadvantaged individuals and families. Healthcare consideration for uninsured and underinsured individuals refer to healthcare consideration for socioeconomically disadvantaged individuals and families. So now it's intellectually disabled individuals. Intellectually disabled individuals are at high risk for certain health disorders. Often, these health disorders go untreated due to atypical symptoms presentations, which leads to additional problems later in life. Communication barriers between healthcare professionals and those with an intellectual disability present a unique challenge in identifying and managing healthcare needs in this population. Again, this pyramid point, do not forget, guys. These clients may have difficulty recalling their personal medical history, so it may be necessary to take more time to ask questions in a variety of different ways. More common health conditions include motor deficit, epilepsy, allergies, otitis media, gastroesophageal reflux disease, dysmenorrhea, sleep problems, mental health problems, vision and hearing impairment, constipation, and oral health problems. These clients may tend to eat quickly and so should be assessed for risk for choking and aspiration. Certain conditions can cause changes in behavior. For example, let's go because I lost the paper. 72. We are on 72 and 73. So we were reading about this. Yes, here. More common health conditions include motor deficit, epilepsy, allergies, and otitis media, gastroesophageal reflux disease, dysmenorrhea, sleep problem, mental health problem, vision and hearing impairment, constipation, oral health problems. These clients may tend to eat quickly and so should be assessed for risk of choking and aspiration. Certain conditions can cause changes in behavior. For example, there may be eating disturbance due to GRD or self-injury due to presence of an ear infection. Healthcare consideration for intellectually disabled and individual safety is a priority. Ensure a safe environment always. Functional behavioral assessment is important in identifying existing health problems. Awareness of altered behavior as a manifestation of an illness important in early identification and prevention of secondary problems. Health interventions must be focused on treating a medical condition, followed by behavioral interventions to prevent continued behavioral response of an illness. So again, battered individuals and victims of abuse or neglect. Again, we have to read. Healthcare professionals are often the first point of contact for victims of abuse or neglect. Abuse of the older client refer to chapter 20 and chapter 68 that of course in future we are going to read about. Child abuse consequences are long lasting, both impacting initial development and influencing adult health. Refer to chapter 68. Of course we are going to read soon. So we are reading, guys, chapter 5, population health nursing. Okay, so we are going to start page number 74 now. As I promised, we are going to read word by word Saunders book, so you will know what it is inside for the Nclex. So let's start. Women are affected more than men. D. Some of the outcomes of abuse or neglect may include physical, somatic, psychological, behavior, sexual, and pregnancy-related effects. E. Children birth to 1 year of age are at risk of maltreatment. The majority are victims of neglect. Maternal socio-economic status and parental behavioral issue impact child risk. Number F. Victims are prone to certain health effects as a Result of the abuse, neglect. These effects can include bruises, sprains or broken bones, chronic fatigue, shortness of breath, muscle tension, involuntary shaking, changes in eating and sleeping patterns, sexual dysfunction and fertility issues. Number G. Mental health issues can arise including post-traumatic stress disorder, nightmares, anxiety, uncontrollable thoughts, depression, low self-esteem, and alcohol and drug abuse. H. Feeling of hopelessness, lack of worth, apprehension, discouragement, inability to trust others, and lack of motivation are common. Children who witness violence are prone to fearfulness, anxiety, depression, and problems in school. Again, these pyramid points, healthcare consideration for better individuals and victims of abuse or neglect. Number 1, safety is priority. Provide a safe environment and ensure that the victim has a safe environment in which to live and is provided with contact information for seeking a safe haven if necessary. Number 2, treat victims with compassion and respect. 3, acknowledge and respect the dignity of each person. Number 4, nurses are mandated reported of domestic violence and abuse incidents. It may be necessary to take photographs of injuries for legal reasons. Cleaning and dressing wounds, administering pain medications, use of assistive devices such as for sprains or fractures, education for self-management, and seeking safety and emotional support may be needed in the care of these victims. Number 6, provide parental education and support programs, increase awareness of potential battering and abuse or neglect. So guys, this video we read about homelessness. Okay, and I will tell you what we have read. Socioeconomic disadvantage in families, common health problems, homeless. So we spoke about homeless in this video. Okay, I'm going to make a short videos, but you should understand and listen carefully what I'm talking about, because I'm talking all things which is provided here. So we have read this all till single parents. So my next video will be on single parents. We are going to read this topic, single parents, in next video. Do not miss next video as well, because you see this pyramid point, it means it is going to be tested in exam. When it is this point, remember always it is going to be tested in the exam. So the next video will be very important for you guys. So listen, watch carefully. If you want to pass your exam, be consistent and listen and read as much as you can. Bye for now. See you in the next video, and don't forget to subscribe my channel. Please share, comment, and thank you for now. See you.